assessing your scalp for size, shape, symmetry, everything looks clean, dry, and intact. Your temporal pulses. Alright, I'm gonna have you raise your eyebrows, squeeze your eyes together tightly, puff out your cheeks, smile with teeth, and frown. Okay. I'm going to have you squeeze your teeth together tightly and open wide. Good. I'm going to have you close your eyes for me. And we're going to assess. Let me know when you feel touch.
Yes. 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 Yes.
Alright, so now I'm going to assess your eyes. I'm going to look at your conjunctiva, which are slightly pale, but everything, your sclera, eyebrows, eyelashes, and eyelids all look clean, dry, and intact. I'm going to have you follow my finger with your eyes. Good. At this point, I would be dimming the lights. And I'm going to have you pick a spot over my shoulder. And I'm just going to assess your pupillary response. And over the shoulder. Alright, I'm going to have you just stare behind me, and I'm going to assess the backs of your eyes. Finding the red light reflex. Internal for the cup and disc, and external for the macula, or medially and laterally, I should say. And same back here, red light reflex, medially for the cup and disc, and laterally for the macula. Alright, so we're assessing your ears externally. You got your Keyshawn's on. And we're gonna assess whisper test before I assess internally. Alright, I'm gonna have you repeat back the words to me.
Red, white, blue, green, black, pink.
Okay, your hearing's good. Now we can assess internally.
That one's been bleeding.
I don't see any blood right now, but
A lot of dead skin.
Your tympanic membrane looks gray and pearly at least. And your tympanic membrane is also gray and pearly for that one. You got a little bit of earwax built up, but
And
you're right here. Right, assessing your nose for symmetry, and I'll have you sniff in. Sniff. Good. And we're gonna take a look inside your nose. Everything actually looks pretty clean up in there. Intact. No papules or anything. Alright, and we'll look at the inside of your mouth. Alright, so looking at the teeth and gums. Everything looks intact. Buccal mucosa. Hard and soft palate, please. Okay, now stick your tongue out and raise it up. Okay, everything looks good there. Alright, I'm gonna have you say ah. Sorry.
Okay.
I'm sorry.
It's not your fault. You have to do it.
Gag reflex.
I've done it more than one in my lifetime.
Okay. Alright, so. Alright, third. So we'll assess your lymph nodes, pre and post auricular, post occipital, post cervical, anterior cervical, supraclavicular, brace your shoulders, good, submandibular and submental. Right, so your trachea is midline. I don't see any scarring or visible wounds. I'm gonna have you throw up your drink and turn towards the camera for me. And I'll have you take a sip. Alright, so I'm gonna have you tilt your head this way and swallow. Good. And take another sip. Turn your head and tilt. And swallow. Good. No nodules or goiter or anything. AP diameter of the chest is 2:1. And percussion. I like using this more. Do you need to scoot forward? Nope. And posterior. And they actually said that I can go posterior with auscultation too to start with, so that I'm not going back and forth much.
Okay.
So you take a deep breath in every time you move. Okay, you can breathe normally.
Thank you.
Alright, so we're going to sense your carotid pulses one at a time. And then I'm going to have you take a deep breath in and hold it. I'm going to have you lean forward for me so I can assess for pulsations and heaves. Thank you. And I don't see any. Alright, back to the diaphragm for heart sounds, aortic. 1 minute. Herb's point. Tricuspid, and apical. Okay, and the bell. I think she was turning this slightly. lift up your shirt for me? Alright. First we're just assessing your abdomen. There is some bruising on your right side from the fall that you had the other day, a little scratch probably from the tray.
Yeah.
And I'm going to auscultate. Everything seems monoactive. So we'll move to percussion. Look for the liver. Right there. So you take a deep breath in and a deep breath out. Looking for the liver, and I can't feel it. And then deep palpation. Alright. You can lower your shirt back down. That's it for abdominal. So I'm going to assess your peripheral vascular system now. So I'll have you just move your hands a little bit. Ooh, nice and twisty. Cap refill is good. Not seeing any edema. Assessing your brachial pulses and radial. Good. I'm gonna steal these. Gotta look at my toes. Alright. Edema. Cap refill. Good. Femoral pulses. See if we can get a polyteal. And pedal. And vestibular. Alright, so that's peripheral vascular. So I'm going to have you sit up now.
Okay.
And we're going to do reflexes. Or actually, we're going to start with assessing if you can feel a cotton bud. So I'm going to have you just relax your hands and have you close your eyes, and you're going to tell me when you can feel.
Yes. 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 Yes.
You can feel in your toes. Congratulations.
But I can't tell a dolphin chart.
You can't tell it all from the chart. That's okay.
They're just a little, not bad.
Alright, now we can do reflexes. Alright, so I'm going to start with your triceps.
That one's there.
That one's really there. Good. Alright, let's see if we can. There it is. There it is. Okay. I think this is where I need you up on the stool.
Okay. Thank you.
Alright, so I'm going to have you hold your hands together and I'm going to count to 3 and I'll have you pull when I tell you to. 1, 2, 3. Let's see. Try again. 1, 2, 3. There we go.
Yeah, that needs kind of swollen.
Yeah. Alright. 1, 2, 3. There, that was better.
That's it?
I'm gonna have you sit back on the normal chair
Okay.
so I can do the bottom of your feet. Oh,
Be kind. I have a problem.
I know, I'm sorry. I did it too hard that time. Sorry. Oh, nope, okay. That's
It's all
alright.
right. Tell them no.
That's okay.
I don't like that. That hurts.
Alright, and then I'm just gonna have you relax this leg and I'm going to assess. Okay. There it is. Alright. Last thing is musculoskeletal, so I'm going to have you stand up
I'm going to do athletics.
and
Acrobatics.
I'll have you bend forward in a dive this way. I'm just gonna look at your spine, which is symmetrical. So I'll have you stand back up, and I'm gonna have you put your hands on your hips, and I'll have you twist to the side one way and then the other. And then I'm going to have you bend at the side one way and the other.
My back likes that.
Alright, and everything looks to be symmetrical, and that concludes our assessment.